everyone, and welcome to today's stream. And I'm very excited to tell you that Dr. Thomas Hornyak is here, and we are going to talk about the importance of sunscreen and also preventing skin cancer. Welcome, Dr. Thomas Hornyak, and thank you for joining us today with this very important topic.
Thanks so much, Rosalia, for inviting me to talk with you and our viewers today.
I would like to have our viewers know before we proceed that if you have any question, no matter where you're watching from, whether it's Instagram, YouTube, or Facebook, that you can put them in the comment section and we will see them, and Dr. Hornyak will be able to answer them. Also, we'd like to tell you or remind you to smash the like button and also to follow us on Instagram and on YouTube and Facebook, so that this way you will know whenever we have a new video coming up. So, Dr. Hornyak, why is skincare such a big issue these days in terms of cancer?
Okay, good question to start off with, Rosalia. And just by way of introduction, my name is Tom Hornyak. I'm actually currently the chief of our research and development service here at the VA Maryland healthcare system, but I also am a dermatologist, staff dermatologist here at the VA. So have a background in seeing patients, evaluating them for skin cancer, and treating them within my scope of practice. So that's good. So skin cancer is very common, and I think one of the good things is that in most cases, when it's caught early, it is fairly straightforward to treat and should pose a minimal ongoing risk to the patient who does find or has found that early skin cancer and has it addressed rapidly. The major complications are when that doesn't happen. And certain skin cancers are more prone to spread, both locally at the site that they start, and sometimes to distant parts of the body than others. And it's when that happens that we run into problems and more complicated, and treatments are required, treatments with more side effects. And of course, in some of those cases, there's mortality associated with that. So it's important because it's common, but it's also very important to try to detect it early and have it managed at the earliest possible stage.
So, what are people looking for when they're trying to find a possible skin cancer lesion? How can they do that? Should people do regular checkups of themselves? Can you talk about how does one find something suspicious?
Sure. And I think to some extent it your question about how do you find skin cancer, um, and it is dependent upon knowing a little bit about the different types of skin cancer. Um, the most common type of skin cancer is called a basal cell carcinoma. Um, and actually, Rosalia, you do have a couple of examples of that right there that we can show. These usually start as small lesions that grow not too rapidly. Um, on the left is kind of the classic pearly papule, a raised small lesion on the skin that has a translucent or jelly-like border. It's firm. Sometimes in the middle, though, it can form a little ulcer, even start bleeding. Patients usually will present this to their physician if it's in an area of their body that they can see. And sometimes a complaint is, um, I have this thing that just kind of starts bleeding on its own, and I don't understand why. Um, this is the most common type of skin cancer, um, but it is also the most addressable. Um, very, very few of these will spread to other parts of the body and cause problems that way. And they can be treated readily with pretty straightforward techniques: skin surgery locally, destruction, even some topical medications can be used to treat early forms of basal cell carcinoma. You see another example there on the right. Sometimes they can be slightly pigmented, a little bit dark. So this is something that usually a patient who's in a position to notice something well on their skin will will do so, and will then talk to their primary care physician about it, who then may make a referral to a dermatologist for further evaluation and possible biopsy.
So, where do these lesions show up? Could it be like anywhere on the body, or do they typically show up like on the arms or the face? Like, is there a specific place where they can be found or where they are found?
Well, they can be found at anywhere, but basal cell carcinoma is associated with um, sort of intermittent, higher intensity sun exposures, especially early in life. So the tendency is for them to be on the face, um, on the ears, on areas of body that are more likely to have had sun exposure, the backs of the hands, the arms, rather than those areas that are conventionally shielded from the sun most of the time. So
So
the
what so
go
what
ahead.
happens what happens once first of all, are there other forms of cancer that are skin cancer that may appear and people may not understand or recognize what they are?
Yeah, there's another common form called squamous cell carcinoma, not as common as basal cell carcinoma, and you can show
Oh,
some
this is
examples
a
of that.
different one. This is
Yeah, yeah. So you see on the left, there's more of like a scalier lesion on a patient's ear. These are just taken from a publicly available um, database with a central sort of what we call an erosion, where it's kind of underneath the surface of the skin. Similar on the right, that lesion near the patient's nose, where it's sort of a little bit crusty and bloody in the middle, but round on the outside. Sometimes they're more wart-like, almost like an irregular, juicy wart, like the one that you see in the center there. And this is also most common on sun-exposed areas of skin. This is actually the skin cancer that's most associated with kind of accumulated sun exposure over life, the type of exposure that, a farmer might be expected to exhibit, as opposed to, someone who just works in an office but goes to the beach a few times a year and gets a sunburn. So once again, face, chronically sun exposed areas of the arms, possibly the legs, most common location for this type of cancer.
so many of our veterans have served in areas where there is a lot of strong sun, like the Middle East, especially our younger veterans. Are veterans more highly um, disposed to having some forms of skin cancer because of being outdoors in either a tropical area or a desert area?
Um, Good question, Rosalia, for our population here. I'd have to say that at this point we don't really know that yet. Um, I believe studies are underway to look more precisely at how the combination of just the kinds of environmental exposures that are part and parcel of military service, but now more recently how toxic exposures might factor into skin cancer um, risk and skin cancer incidence in veterans. There are some scattered data to suggest that skin cancers, sort of age for age, are more common in military populations, but I think we have still quite a bit more to learn that way.
So we often hear about melanoma. Is that related to any of those photos that we saw previously, or is that a totally different kind of skin cancer?
It is a different can of beans. I think you have an example of it right there. And so melanoma is a cancer of the pigment cell of the skin. The other two more common cancers that we talked about are cancers of the sort of the principal stuff of the outer cell, outer layer of your skin. The cells that make up most of that outer layer. Your pigment cells are kind of dotted among those cells. And when one of those cells turns malignant, the result is a type of skin cancer, the example of which you just saw there, melanoma. Now, melanoma is concerning because it really is a more dangerous skin cancer than um, either basal cell carcinoma or squamous cell carcinoma. Um, Although, like the others, it can be easily treated with local surgery if we find it quickly or early. It does have uh, a higher chance of spreading to other areas of the body if it isn't um, detected and treated at the earliest possible stage. So that is, I think what we and a lot of people are most concerned about, trying to identify melanomas, wondering about whether there's anything that we can do to reduce our risk for melanoma, and then trying to get it treated early, um, if at all possible.
So I'm seeing here this slide about risk factors for melanoma, and you talked about pigmentation.
Yeah.
And this actress from Sex and the City is redhead. Does that have anything to do with who's more at risk for melanoma?
Yeah, that's great. The We do have a lot of work has been done to really try to define what makes people at a higher risk for melanoma, in part to sort of see if we can target screening efforts to those people so that the limited resources that exist anywhere to be able to bring forth to for screening purposes, and for self-education purposes can be used on the population that is going to benefit the most from it. So we know from a bunch of different studies that have been done that people who have lots of moles, these dark flat lesions on their skin, again, more but not exclusively localized on sun exposed areas, have a higher risk of developing melanoma. The general ballpark is that if you have 100 more moles, you are at least at a few to several fold higher chance of developing melanoma.
On
Uh,
that slide, we saw those moles on a
yeah,
person's back.
yeah,
How does one self check for any kind of skin lesions on one's back? How does one do that uh, if one is doing self checks?
right, right. So I think talking to it's it's important to talk to patients who have lots of moles about doing that. One way to do that is to we advise people on their birthday each month, their birth date, I guess. If you were born, I was born on July 20th, so I would do it the 20th of each month. You look at your skin. You look at at your front, and then you turn around and turn around in front of a mirror and hold a mirror in front of yourself so that as best as possible you can see your back. You can get to know your own moles, and see whether any mole is different in any way. Sometimes it will call attention to itself, but otherwise not. I do think that people who have more than 100 moles are among those people who really would benefit from a periodic screening exam to again detect any melanoma that might arise as early as possible. It's not like all people with lots of moles are going to develop melanoma. The ballpark in North American Caucasians, at least 1 in 75 or so will develop melanoma over their lifetime. But if you increase that chance by, even a few fold, you're bringing it down to the 1 in 20, 1 in 15 range, which is the range where we do screen patients with other risks for malignancy routinely for signs of early development. So I think it's reasonable that um, that these patients be screened. Um, Red hair is another risk factor. We know that red hair has a genetic basis, and there's a relationship between the genetic basis of red hair and the degree to which one can produce pigment on the skin, and also repair damage that occurs to DNA um, because of radiation from the sun, ultraviolet radiation. So I think that even though the risk of melanoma in redheads and other skin cancers with redheads probably doesn't quite approach the risk in patients with lots of moles, it is of the same order of magnitude. So it's probably reasonable that redheads also be screened, you know, on a yearly basis or so for new skin cancers, at least once they reach a certain age.
So let's talk about prevention. You said once people reach a certain age, what age is that people need to start being more paying attention to their bodies? And does it matter? Like, I have a relative who like worships the sun, is in the sun every chance she can get. So does is that a factor in addition to age, even if one has not reached a certain age?
Well, I mean, it'd be nice if we could draw hard and fast lines, right? But we can't. And it's not just skin cancer, but for the most part, the risk of any kind of cancer increases with age. Age is the most significant risk factor for developing skin and any other cancer, right? So I do want to say though that what's nice about identifying risk factors is it does allow us as physicians to really kind of focus our efforts on those who are going to benefit from screening the most. Um, a routine skin cancer screening is not recommended for everyone in the general population. This has been looked at very closely by the U.S. Preventive Services Task Force, which is a group that's assembled to really review evidence and make recommendations on screenings for many different types of conditions. And they have in 2016 they did their last full review, and there was a more recent reappraisal in 2023, looking at all the evidence, and there's they've concluded there really isn't any demonstrated benefit for routine skin cancer screening of the population at large to detect skin cancers. There's also no significant harm they reported. There can be harm associated with overscreening, with overdiagnosis, with some of the procedures that can occur that can follow at least suspicion for cancer. So it's important to keep that in mind as well. But screening, I think, is important for individuals who have a higher risk of melanoma, like we've discussed. Lots of moles, red hair, a family history of melanoma, or even having had a previous melanoma or cancer of the pancreas. And that may sound weird, but it just the same underlying genetic reason that can make one more susceptible to develop melanoma can also make someone more susceptible to developing cancer of the pancreas. Some other populations that should be screened actively would be recipients of solid organ transplants, kidney transplants, liver transplants. These are people who really have to live their lives on drugs that suppress the immune system. And we know that suppression of the immune system is associated with a higher risk of skin cancer developing. You're removing one of the kind of checks and balances against it developing when the immune system is inhibited. Some other people who have numerous what are commonly called keratoses, we call them actinic keratoses, not one or two, but sort of fields of them on different areas of the face, rough spots. We do see a higher chance of those patients developing squamous cell carcinoma. So I think it's reasonable that they be screened routinely as well.
So, can you talk about what people, aside from self checks, what they can do to prevent or at least minimize the risk? We see a lot of news out there about always putting on sunscreen. So, can you talk about those habits, if they're good habits, um, what to look for when one is choosing a sunscreen?
Sure, sure. So I think, we wish we could do more. I mean, there aren't any magic pills yet that um, can can help us in that regard. But I think, the two best things to do would be to avoid sunburns. The evidence is best that it's really sunburns that contribute most directly to it's the as the environmental cause that contributes most directly to developing skin cancer. So I think whatever you can do to avoid sunburns is important, and that involves using that right combination of sunscreen, sun protective clothing, and trying to avoid the most intense periods of sun exposure in the early to mid afternoon. That works for you. Some people may, like to use sunscreen on more areas of their body. Others may prefer getting a shirt that is loose fitting. There are even some companies that make clothing that has the type of sun protective rating that sunscreens have, using that more so than sunscreen and just applying the sunscreen to areas of the body that remain exposed after maximizing the use of sun protective clothing and a nice wide brimmed hat. So that can all really help to avoid sunburns, which is likely to reduce your skin cancer risk across the board. The other thing that I would like to mention is avoiding the use of sun tanning beds. Um, there is now um, evidence actually from a large study of a cohort of nurses who were recruited really for participating in studies of various types of medical conditions, that tanning bed use is associated with increased risk of all three of the types of skin cancers that we've discussed.
Yeah, there's a lot of people out there who still like to go to those tanning beds. So,
Well, there's also evidence that tanning beds can in a way be addictive by stimulating the formation of the same types of opiates in the body that
oh,
are used to treat pain. So that's probably one reason why people like.
so is there anything that veterans in particular should know about preventing skin cancer or applying lotion, especially since they've been exposed to, like I could see sailors on a boat, maybe with their shirts off when they're sailing, and then those folks who are in the Middle East theater. Do you and what do you want veterans in particular to know about preventing skin cancer, or at least if they find a lesion, what happens then?
Sure, sure. So I think in terms of preventing skin cancer, I think there's evidence that the routine use of a sunscreen can reduce at least the risk of developing squamous cell carcinoma. So for more fair skinned veterans, I think that that's a reasonable approach. I think for veterans to use that combination of sunscreen, hats, and clothing to avoid developing sunburns, that's also going to help quite a bit. For veterans who have already had skin cancer, there may be some approaches that are, specific for you that that can help. There's even a topical medication, and that can help reduce the occurrence of a second episode of skin cancer if you've already had one. In fact, it was VA research that established the fact that the use of this medication could reduce the incidence of a second skin cancer in veterans who already have had one. So I think it's that combination of strategies. I think if you are um, in that category where you've had a skin cancer already, talk to your doctor. You can make appointments directly in dermatology here at the VA Maryland healthcare system for that purpose to talk about some of the more nuanced, sophisticated strategies that might be right for you. Um, and there was a second part to your question too that I'm trying to remember so I can make sure I address it well, Rosalie.
What happens once someone comes
Yes.
with us? What happens once there is a lesion? What's the next steps? Because it's one thing to identify it; it's another thing to treat it. So
Exactly. You can, either see your primary care physician. Sometimes your primary care physician here in the VA Maryland healthcare system will suggest that you first um, have a have the lesion imaged. We provide teledermatology here at the VA Maryland healthcare system, where perhaps more rapidly than coming in, or at a shorter distance than coming in for an appointment, a picture can be evaluated by a dermatologist to assess, whether your new lesion might represent the skin cancer and that you need to come in for a biopsy. You can also make that appointment on your own to have any new lesions or lesions that you're just not sure about evaluated and managed as they should be um, after a considered evaluation by one of our dermatologists.
so once something is identified as cancerous, what is the next step? I mean, is it removed? When you say it's biopsied, I know everyone knows what a biopsy is, but is it to identify the kind of cancer it is? And
Yeah,
also,
yeah,
yeah, uh, can any of these cancers be fatal?
right, right. So usually the diagnosis and treatment of skin cancer is at least a two-step process. The biopsy is performed, that is looked at under the microscope by one of our pathologists to either confirm or determine whether it is a skin cancer and what type it is. The type is important, especially, for example, with melanoma, where the details really matter, and how deep that melanoma may have penetrated into the skin is going to determine the extent of the removal that's required for adequate treatment of that melanoma. At the later stages, and we wish this weren't the case, but the depth is going to, be able to be used in some way to predict survival from that. Again, emphasizing the importance of having these lesions detected and treated early. But it's a two-step process. It's important to know that and not to expect that your potential skin cancer is going to get diagnosed, fully evaluated, and treated in the course of a single visit.
Well, in this instantaneous world, that's an important thing to know that it's going to take more than one visit. Do people with skin cancer lesions, and if it's a melanoma or any of the other ones, do they end up? Are they candidates for chemotherapy, uh, or that depends on the cancer and how much it's spread?
It depends on the cancer. With melanoma, we there have been some really great advances over the past, I would say, 15 to 20 years that have given much hope to melanoma patients with advanced forms of the disease that just was not wasn't present before. Currently, melanoma patients with more advanced disease, where it's spread elsewhere, or where there's a substantial risk of it spreading elsewhere, will be treated either with a type of therapy called immunotherapy, which is actually therapy that is based upon an infusion of a liquid containing a therapeutic antibody that actually doesn't treat the cancer itself, but it boosts your own immune system's ability to fight that cancer. And these have been very effective um, for patients with advanced melanoma. The other type is sometimes it's referred to as chemotherapy, but really the better term is targeted therapy. These are generally pills, not chemotherapy in sort of the classic way and the side effects that occur, but more targeted types of treatments to the specific type of melanoma that you have. So really working towards something called precision oncology with melanoma treatment.
Well, it sounds like there's hope out there for people who are newly discovering lesions, and also maybe for those who are already in the treatment of cancer to, at least go into remission. How does that? Can one become free of skin cancer once it's treated? How does that work?
Sure, I think the at the early stages, basal cell carcinoma, squamous cell carcinoma, melanoma can be all relatively readily treated with high confidence that the cancer is cured. Once the cancer becomes more advanced and is not able to be removed surgically or has spread to other parts of the body, then it becomes more difficult to say that someone is cured. But we do know that the longer that you remain cancer free after treatment, the likelier it is that you will remain cancer free. So, generally, if you've been treated for a more advanced form of melanoma, at least, and you remain cancer free after a few years, um, your chances of surviving cancer free for the rest of your natural life are quite good.
That sounds great. We have a question from a viewer on Facebook. Dr. Hornyak, can you talk about SPF? It seems like the numbers keep getting higher and higher, but is a super high SPF number really needed?
Great. I'm glad that you asked that question about SPF. I actually had previously prepared some information on that. So SPF refers to sun protective factor, and it's a measure of how well a particular sunscreen or, like I mentioned, sun protective clothing blocks the ultraviolet rays from the sun. The way it works is if a sunscreen has an SPF value of 15, that means it's blocking 14 out of 15 parts of sun that are hitting the sunscreen and trying to get through. So basically, it's blocking 14, 15, so about 94% of those ultraviolet rays that are hitting the sunscreen, and only letting about 6% of them through. In SPF 30, it's better, but it's not that much better. It's blocking 29, 30. It's about 97%. So in SPF 15, about 6% is going to get through. In SPF 30, 3% is going to get through. Well, both of them are blocking the vast majority of, rays. So that's where, your personal choice, how you use the sunscreen, and frankly, your pocketbook come into play, because um, it, it, if you use the sunscreen well and you don't have one of these more rare conditions that certain patients have, where they are excessively sensitive to sunlight, then it doesn't make sense to pay several times more, in my opinion, for an SPF 50 or 60 compared to an SPF 30, because an SPF 30 is going to block everything except 3%, 50%. An SPF 50 blocks 2%. Both of them are highly effective if they're used in the right way. I will say, though, that it's commonly thought that the way people apply sunscreen on their skin is at about half of the thickness at which it's tested. So an SPF 30 that results from its evaluation under testing conditions on your skin, it might just be working like an SPF 15. So I think an SPF 30 or greater is fine. Um, Probably more important is applying it, well enough in advance of when you go into the water so that it has had a chance to absorb into that upper layer of skin and provide the sunblock protection that it can, and to reapply it. If you come out of the water or every hour and a half or two and you're still out in the sun, put another layer on, because it doesn't work forever.
So, can you talk a little bit, now that we have the sunscreens out of the way, can you talk about those other products that are on the market, like Banana Boat, that stimulate getting a tan? Somebody once said to me, tan skin is damaged skin. So, can you talk a little bit about those lotions that maybe don't block anything at all? I don't know how they work. So, but people want a tan.
Okay. Yeah, I don't know how they works. I'm not specific. I'm not familiar with Banana Boat or any, and I'm not endorsing any one specific product over another. But I am aware of self tanning lotions that can create the appearance of a tan. Those are stains, right? They are not chemically formulated to block ultraviolet light. So they're not providing any sun protective factor. I think if you do use a self tanning agent, you still have to use sunscreen to 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 block the ultraviolet rays. The self tanner isn't doing that for you, even though it's making your skin look darker. I think that trying to select a sunscreen that blocks both what are called ultraviolet B, UVB rays, as well as ultraviolet A or UVA rays is preferable. Most of the FDA approved ingredients block UVB. The only FDA approved ingredient that blocks UVA, which is the longer length wavelength ultraviolet light that penetrates more deeply into the skin and is principally responsible for photoaging. The only FDA approved ingredient is called avobenzone. So I would be looking for a sunscreen that contains avobenzone.
Can you spell that? I'll put it in the comments so that
Sure,
everyone can see it.
sure. It's AVOBENZONE.
Okay, AVOVENZONE, Avazone.
AVO, and then B as in boy.
Okay, I got it. BEN benzone. All right, I got it
Yeah,
in the
zone. Yeah,
comments,
zone
everyone.
as in end zone. Yes.
Yes, I got it in the comments, everyone. So look for sunscreens that have that in it for the more safer one that blocks UVA.
Yeah, and there is one other ingredient that's approved as part, not on its own, but as part of an overall approved sunscreen product as well. Um, just to throw that in there. Um, but yeah, it's actually harder in the United States than in Europe to find approved UVA blockers. But that's what I would recommend: a combined UVA blocking sunscreen that that contains avobenzone. The other choice, though, is a physical sunblock. These are generally metal ion oxides, like titanium dioxide or zinc oxide. Some people don't like them because they can leave more like a white paste type appearance on the skin. But these are also very effective for observing uh, for absorbing ultraviolet light across the spectrum.
I think a lot of lifeguards might put that on their nose. We see them with that white stuff or blue stuff on their noses.
Right.
All right. If are there any is there anything that I didn't ask you that you think our viewers really need to know about preventing skin cancer and using any of these sun prevention, UV rays blockers that I didn't ask you that you think is important?
Yeah. No, I think the takeaway is do whatever you can do to avoid getting sunburned using the combination of a UVA UVB sunscreen or physical sunblock. Um, Stay out of tanning beds. Um, think about some of the risk factor stuff that we discussed and talk to your doctor about whether you think you might be in one of those categories and could benefit from routine screening. And otherwise, just go out there and have a good time.
All right. Well, thank you so much, Dr. Hornyak, and I appreciate your time. Thank you, everyone who is watching. We got one like on Facebook, so we appreciate that. So if you have any questions moving forward, just put them in the comment section. I'll be more than happy to send them to Dr. Hornyak to get some answers. So
Sure.
thank you very much for watching, and that's the end of our stream today. See you later. Bye-bye. Until
Okay,
next
take care,
time.
everyone.